Well, welcome back to the Pastor's Podcast. Pastor Scott here with Jacy Corral.
Hello.
And Talitha Phillips.
Hello.
Many of you know Jacy. She's been a part of Cornerstone and Shoreline before it for a lot of years, forever. That's its own story.
I think we've done that on the podcast.
I think we have. I think we have. And many of you, if you've been around for a while, like Jacy, you probably know Talitha Phillips, but if you're newer, you might not. Talitha is the CEO of Claris Health, where you've been serving for also forever.
Ever. Almost 24 years.
Almost 24 years. Yeah. As the CEO of Claris Health, Jacy, in addition to being a member of Cornerstone, is also serving as the president of the board for Claris. And so, so thankful for you guys to take this time, get to talk about a organization that is so near and dear to my heart, to our family's heart. It means so much to it, and also so much to our churches, so close to our church's heart. I think this has been a partnership for a lot of years that means a lot to us. I mean, even having the Parenting Resource Center and stuff here on campus, that was an idea even a number of years ago that has been a huge blessing, actually.
Huge. Yeah, huge.
I mean, before that, the Resource Center was upstairs in an office building off Pico.
Mm-hmm. Mm-hmm. Yeah, a lot of pregnant women walking up a lot of stairs.
Super narrow. All I remember is like a super narrow stairway.
No elevators.
Yeah. No. Try to like get your, we'll give you a stroller, but you have to get it down.
Yeah.
Sidewalk that baby out.
Exactly.
So for those that aren't familiar, Talitha, can you just give a quick brief recap of what Claris does? I think most of our people are, but there's also lots of new people that this may be the first time they're really hearing, or maybe Sunday was the first time they heard about Claris.
Yeah. So I know to not get into all the details of all the things we do, but at a high level, we work primarily with pregnant women and families with kids under the age of 5. We do medical, mental health, and support services. And I think the heart of what we do is really looking at it sort of before, during, and after these situations. And so, somebody might walk in and they're facing an unintended pregnancy, and it's not just caring for them in that moment, it's caring for them for the first 5 years of that child's life. Or if they choose adoption, understanding that there's a lot of support needed for that, and those who choose abortion, understanding that is also something where we can wrap our arms around people in the months and years that follow all of these heavy decisions that are life changing, regardless of what choice is made. And so being there for individuals, and then I think recognizing that every person that walks through the door lives in a community. There's family members, there's parents and partners and siblings and other children. And so really wrapping our arms around the whole family and seeing this as not just a women's issue. It's not just a women's health issue. These affect entire families. And so how do we equip and care for families?
Yeah.
That's kind of why we exist.
Realize I asked you for your elevator pitch, and I remember practicing them with you. I remember you teaching me how to give. Yeah, how to give. So
I feel like I gave a very good elevator.
I don't know. This is like turnabout. I realized I was like, oh, now I get to ask you. So Jacy, how long have you been involved with Claris?
I mean, as long as you and Laura spoke to the church about it years ago. I mean, I started as a volunteer on the marketing and graphic design side. I'm a professional graphic designer. And I have files dating back to 2012 of gala invitations and things that we worked on. So it's been a long time. I'm in my 4th year on the board of directors.
Okay.
2nd year as the board chair.
So what, just as a little aside, what does that mean? I think for some
be
people,
on the board?
Yeah. What does it mean to like be on the board? Like,
what does it mean, Talitha?
How are you?
Tell me what it means.
How are you involved? And what does that look like?
So for those who don't know, Scott was also on the board and was the president of the board of directors at one point.
That's why this is fun. It's fun to sit here. And,
I'm sitting with my grandfather. So essentially we have a a heavily oversight board. And so we are not intended to be in the weeds day to day with Talitha and her staff. We fly at 30,000 feet and try to provide Talitha with the support, vision, direction that she needs to be able to do the work that she just explained well. So we are really more on the vision casting side and the support offering side. And Talitha is our link to the rest of the organization.
Awesome. Okay, so Claris does a number of different things in serving families, both through pregnancy and, like you said, up to through having young children up to 5 years old. What can you maybe give us an overview of? I think even people that are here at Cornerstone that have been here a while, that are familiar with Claris, may not understand all that Claris does and all the different places and even parts of the city that Claris is involved in. And so, so what all does Claris do, and what does that look like in our city? Yeah,
so it's probably easiest to explain the before, during, and after pregnancy. So for those who are not pregnant yet, we do offer woman exams, and we have a mobile clinic that drives into some of the harder to reach parts of the city, doing general health assessments. And sometimes it's early prenatal care. Somebody might come on, we do pregnancy testing, we can verify the pregnancy with an ultrasound. And then just a lot of general health and women's health services. And then we have 2 clinic facilities. So one is in South LA in the city of Linwood, which for those that don't know where Linwood is, it's very close to Compton and Watt, sort of in that area. And then we have a clinic in West LA here off of Olympic Boulevard, very close to the church. And those clinic facilities do more sexual health and pregnancy services. So we do everything from, all the things I mentioned on the mobile, the STD. We can do sexually transmitted disease testing and treatment. We can do women. We do prenatal care. So at West LA, we do very basic prenatal care. In Linwood, we run an incredible program called Centering Pregnancy. It's a group-based prenatal care. I think that's something a lot of people don't know that we do. And it is
the fullness of that actually might be news to me. I'm not even sure I remember that.
Post Scott.
That's right. Yeah.
Claris. But what's incredible, so in our country, I think a lot of people are aware of just the infant and maternal mortality rates, especially among Black and brown women, and how horrendous the outcomes can be for moms and babies. And so Centering Pregnancy is an evidence-based prenatal care program where your entire prenatal care is provided in a group setting. So you get your traditional medical visit, but you also get that peer-to-peer learning. You're in a community. So you are paired with other women who are all due within about 4 weeks of each other. So every visit you come to, you get, the education, you get the support. Even the visit, you're in a circle with other women. You get a little one-on-one time with the provider, but if you think about, traditional prenatal care, you go to your doctor, maybe she or he spends 6 minutes with you, and you need to come prepared with all your questions if you want them answered. And it's just very medical. And then you might take a childbirth class on the side. But in Centering, you get that class and that visit and the questions, and you're hearing from others. So you might think, is it just me that's struggling with insomnia, or why are my feet so swollen? And then you're in a class with others and you realize these are normal, these are normal things. So it's for low risk. We have to keep everyone sort of low risk. If they're high risk, we do transfer them out. But that program has been incredible. And then, say the baby is born, then we have a whole program for, parenting, and there's, one-on-one classes, there's group classes, there's mentorship. One of the newer programs we've launched in the last several years is a program that fulfills court mandates. So anybody that, or they're court-approved classes. So if Child Protective Services is involved, or if there's even just the threat of involvement, we have these classes that will satisfy the court requirements. And what I love is they're not just classes, but they're so relational. So we have One arm of that's called EMA. It's Every Mother's Advocate. And many women from Cornerstone have become EMA advocates. And you are trained to provide the classes. And so we match one mom to one mom or one mom to one woman. You don't have to be a mom to teach it. But it just provides a lot of that, care and support and all the relational things that are really tricky that you don't typically get in a class. And we're able to offer them for free. So that has actually exploded, especially since COVID, around the nation now. Courts are accepting that. So we have clients in that program as far as New York and Mississippi, and we had a client in Italy.
Wow.
And we're able to provide those virtually now as well. So that's been incredible. And then with that, there's material assistance too. So we have a little baby store, or if somebody, if we've had a mom in EMA that needed mattresses for her kids so they could come home, because that was a requirement from the social worker. So we were able to provide mattresses and, any need that comes. We don't want there to be a barrier that keeps families apart. So we're able to do that. And then on the mental health side, we have peer counseling and professional counseling. We take interns, trainees, and associates from Pepperdine and post-Pepperdine typically. And so we have that aspect. And then support groups. So, if we have a post-abortion support group. We just started one this last week, first time since COVID that we've had an in-person post-abortion support group. That's a 10-week group. And adoption, support, and just building community so that people know I think Claris means clarity. And I think the idea of, women's health, sexual health, can be very overwhelming. And I think there's a lot of just confusion and often really dark, hard times. And so being, the idea of bringing clarity into these confusing situations. And I think a lot of that comes from knowing you're not alone. It feels very dark and overwhelming. But when you can present options and help people know there's always a way forward. And painting these brighter futures for them really helps give people the hope they need.
It's so beautiful. And I mean, it's powerful to hear the whole kind of swath of services and ways you come alongside people and families. I would love to hear you speak a little bit to, I feel like the pregnancy space is one that Christians are often involved in, right? That as Christians, it's not unfamiliar for people to come to church here and have the church have a connection with clinics that are working in the pregnancy space, in supporting mothers, in meeting needs in the midst of pregnancy, and when people are confused and overwhelmed and don't know what to do about their pregnancies. Why so many programs, right? Why the kind of this whole constellation of things that you're doing to serve these families?
Yeah, I love that question because I think, I've been here 24 years almost in this role. And I think in the early days, there was so much focus on the pregnancy and the decisions around that pregnancy. And I think being in a city like LA, realizing, hey, if we want to present options and if we want to tell people, hey, you could have this baby, and is that the focus? Is the focus that, we're encouraging people to have their babies? What happens when that baby is born?
Yeah.
How do we actually encourage healthy, thriving families and not? So I think there's experts. We're not decision-making experts, right? We're walking with family experts. And in doing so, your focus isn't on the outcome of a decision. Your focus is on the life that this family or person is going to live. And in doing so, it's less about you and it's all about them, right? So then I think we looked at a city like LA and we're like, gosh, it's really difficult to have a baby in LA. Or gosh, there are a lot of abortion options in LA, but what message does that send if you walk into any clinic and, they're encouraging abortion, but what if that's not something you want? Or what
if
if the
you're
church
conflicted
is
about it.
saying,
Yeah.
yeah,
You
they're
don't
super
know.
conflicted. Or what if the church is saying, hey, adoption is the best option, or it's the most, women who place for adoption are, making the most sacrificial decision. Well, then what does that say to you if you don't? So I think there's a lot of messages that especially the church has attached to without thinking through how do we play these tapes forward in a very urban city with, a lot of people don't have family here. And then, and I think one thing I didn't mention when you asked about Claris that is really important to us is that Claris, we do a lot, but we are not called to do everything. And so our attention shifted years ago to saying, okay, we need other providers in this city that we can link arms with. And so our focus was who's doing what in this city. And instead of saying, here's a list of 50 phone numbers to call, it's who do we know in this city? So our list has grown to about 400 community partners in this city where we can now link arms and say, okay, it's more case work, but it's very personal. So churches will call us and say, somebody walked in and they're homeless and they live in Koreatown and where should I send them? And our caseworkers are like, oh, you need to go to this place and you need to ask for Jennifer. And, so it's finding resources to say, how do we help people navigate these really difficult systems, especially if there's a history of trauma or mental health or any of those things? The focus has become so much more about the whole picture and not this sliver in time.
Yeah. I love that.
I was going to say the whole picture and the whole person, meaning everyone involved. And I think when you ask that question about the church, it brings to mind just that Imago Dei, right? And the church so heavily focuses on that image of God and the image bearer in the baby, which is right and good and true. There are all of these other people who are image bearers who are involved in that decision, in that outcome, in past traumas and past decisions that have been made. These are whole people, real people coming through our doors or going through our partner's doors with more than this one thing on their mind. And that's one of my favorite things about Claris is this attempt to be as loving and comprehensive as possible in loving that whole person. And that's why we have things like peer-to-peer counseling and therapy and group counseling and really drilling down to more than that objective decision. Like you said, we're not expert decision makers, but we will come alongside you as you navigate the waters of your real life. Another component of services that we offer is this whole youth education program. In Reality Check, we're talking about before, hopefully catching youth before they're having to answer some of these questions about their own sexual health or unintended pregnancies. We are reaching out to and training middle schoolers and high schoolers across the county. I mean, last year we spoke to more than 10,000 students.
More than
13,000 students last year about their own sexual health decisions, but more than that, their relational health and their emotional well-being and what they're being told about themselves from the media and how they navigate these decisions and how all of that adds up to a whole person who is going to make some really big choices in their lives. And we can love them well early with information that I think as the church and as we're all parents of middle to older age children, right? And still children, not all adults yet, but we really care about them being able to be equipped to go and make these good, healthy choices. And what I always try to be careful about is not so that they don't need our services. It's so that they will be even more informed when they do end up having to make these decisions, right? Whatever kind of spectrum that happens on. I never want to undignify someone who needs our service. Like I want them to come and to find us and know that they're fully loved there and there's no negative connotation to that whatsoever.
It's so beautiful. I love that. I love getting to hear you both talk about it. I mean, 'cause it is. I mean, and to me, that's the heart of Christ, right? The heart of Christ isn't simply about. Jesus was never about make the right decision, right? He was about let me walk with you and empower you, show you, treat you with respect as an image bearer, and honor the image bearing nature of all life, and walk with you through these difficult moments, these difficult times, these confusing times with a ton of grace and kindness. And so it's just beautiful. Beautiful here. Okay, so I want to talk. We could talk about that for a while, but I want to talk about kind of big picture, some of the new steps Claris is taking, because there's a lot of development going on, kind of organizational development, even just vision for what the kind of the structure and form Claris will take into the future. That's you're beginning to take practical steps in right now, and so. Yeah, what's going on? What's the new development at Claris right now?
Yeah, really exciting, crazy exciting. I think to back up or to add to what you're saying, I think one of the things to be mindful of is that these are not just like even the term women's health. Like, yes, we serve a lot of women, but we recognize that this is not just a women's issue, and so. We have always had this place for men as well in serving them, and this conviction even that the information we're providing her, we also want to provide him. And we have a lot of dads that we're supporting and serving just independently, that dads who come to us or young men. And so I think this new development is that when I was talking about partners and not doing everything, one of the sort of issues in our city that we've not been able to overcome is just Los Angeles is massive, as everyone knows. Research has shown that typically if a person walks into a social service agency for help, they're given an average of 6 to 8 referrals to other organizations. Or practical example, you have Medi-Cal insurance, you find out you're pregnant, you're assigned a provider in Long Beach, but you live in downtown LA. You have to somehow get to Long Beach for your prenatal appointments or figure out how to switch that, but then you also have appointments in East LA and just the trying to navigate. So what often happens is you just don't go to your appointment because you can't get there. There's transportation issues.
You may not have childcare for other children.
Yes, and you can't bring your children, or you have a real mistrust of the medical community, and you don't want. So as we were looking at all of this and realizing when people come to Claris, they love Claris because if you've never been, you should come take a tour. But it is this very beautiful, calming. It's like whatever you're walking in with, you can just exhale.
But so then homey. Like it feels like a home, not a medical office.
Exactly. Yeah. Or as one of our clients said, she said, it's like going to your granny's couch.
Oh, but way more modern and pretty than that.
She's like, when you go to your granny and you just lay on the couch and she listens to you, that's how Claris feels.
Oh, that's the feeling.
But yes, no flower printed couches.
Yeah. You said you can exhale.
You can exhale. But then you have needs beyond the doors of Claris. So we were caught in this warp, even though they're warm handoffs and even though it is whole person care, it's difficult for them to navigate. So we thought the board in 2020, we had a strategic planning meeting, which was kind of a bizarre year, August of 2020. And we're like, what?
My first meeting on the board.
Was that your first meeting? Oh, no wonder. It's all your fault. Oh,
no, it was handed to me. They were like, we want to do this thing. Can you join?
Oh my gosh. So we're on a rooftop because it was COVID and we're outside and we're planning. And we walked away and spent the next 6 months or so developing. But what came out of that was this desire to build a campus where we would bring other nonprofits under one roof and eliminate some of those barriers, but not just another building with lots of resources under one roof, but it would be a community center. So one of the number one issues is childcare. So that we need to have daycare, free childcare, so you can come and drop your kids off and access any service in the building for a few hours. We wanted a coffee shop so that it felt like the community, so others could come in. We wanted a basketball court and a safe playground. And so flash forward, doesn't feel like flash forward, but 4 years later, we bought a building. And it's in the city of Inglewood.
So you bought a building?
Yeah. Yes.
So it's bought?
It's bought.
Oh, she's purchased.
Yeah.
Oh, yeah.
Yes.
So, it's in the city of Inglewood.
Yes. It's at Manchester and Crenshaw.
Okay.
So it's, Manchester, Crenshaw, which is a little further west than we wanted to be. But it's just been interesting, the doors that God's opened and just the confirmation that it really does feel like the community we're supposed to be in. As you know, Inglewood has been rocked in many good ways with stadiums and, YouTube theaters and all sorts of things. But it's also caused a major shift in the residents that are there. And it's causing a lot of, issues in the city. And Crenshaw Boulevard is the corridor to South LA.
Yeah.
So we're right there. We're, literally could throw a rock at a bus stop. That's a major bus stop for South LA. So we bought a building that we're tearing down. We've been working. So many stories to all of these words. I'm like, yeah, we bought a building, no big deal. Now we're tearing it down, no big deal. But it was really, really big deals. But yeah, we had 2 donors give incredible lead gifts that allowed us to purchase the building and get started. And we predict we'll probably break ground somewhere toward the end of this year.
Okay.
And build, and it's going to be a 3-story building with a rooftop, and we have a nonprofit coffee shop.
Like a public rooftop, not just 3 stories with a roof.
No, like an event space on the
It'll
roof.
be like an event. Yes. Thank you for.
Yes. We will have
and
a roof.
it'll have a roof.
We will have a roof.
A couple windows.
Yes. No, a
No, like
rooftop
an event space.
So that
Got it.
nonprofits. We've even thought about potentially having a church rent out the space on Sundays, and then so we really wanted this, and it's really neat because where you are in that city, from the roof, you can look to the left and you see all of South LA, and you can look to the right and you see, SoFi. And so, but yeah, being able to have a place that, tenants in the building can access and not have to pay for small events, like that's a big thing. Anytime we want to do an event, it's like you have to go, where are you going to go? How much does it cost? The rentals. And so having a space that people could use. But yeah, we have some anchor tenants who've said yes. And then we're also envisioning just a lot of almost like if somebody can come in and just rent out the conference room, or if you're a counselor, we'll have counseling rooms that you can just use. And then there are some, anchor tenants that are going to meet some of the needs.
Okay. Yeah, you can tell me this isn't public information. Yeah, that's totally fine. But I'm super curious as to, as you think about putting services together, like what kind of anchor tenants, like what kind of other services are you working to put together?
So right now, one of them provides pediatric care and more family medicine, general health. We've got one that is they do insurance. So they help people sign up for Medi-Cal and just navigating the insurance system. We have an organization that works with trafficking survivors. And in fact, the coffee shop is also very, the proceeds go to, it's actually called, the parent organization is called Talitha Coffee, TK Coffee, but the organization will be, I think, Inicio. We've got an organization that does domestic violence services. So really broad. And I think
But in a sense, broad, but also you can see how these services overlap significantly.
Yes.
And how you are breaking down so many barriers, having all of them in one place where you can, where a referral is go next door, not call this number and take a bus to the other side of the city.
Exactly.
Yes. And the idea is that when you walk in the campus, you are actually met with like a care coordinator. So you might say, oh, I'm here for Claris, but there's one intake, and then you go to so every time you can check off other needs that you might have. So say you're coming today and you need to go to Claris for an appointment, but you see that there's also a housing resource or legal, family law. You can click that and they'll make you an appointment for you to come back. So I think that's really, it's not just a building that has, it's like, how do we make sure everyone knows what's available to them? And that's what that's the model we're thinking through. And our team has like, these are the A-list resources we need. And then, okay, these are the B-list resources. And so really trying to, who's going to provide the free childcare, and connecting with organizations.
Oh my gosh. I love that, because you're not just trying to fill the building with tenants, right? You're collating a service provider that that doesn't exist. I mean, like a big picture service provider like that doesn't exist in the city.
And that's in the 5 years of work that we've done on this and the research that we've done, that's what we found. This model doesn't exist anywhere. And I think that's the long-term visionary hope too for Claris and the leadership at Claris, is that this becomes a model that either, God willing, we recreate or we commission others to go create in different states across the country and maybe internationally, because there's something to this, right? There's something to saying we can't be everything to everyone, but there's so much support available if you have the resources to navigate it. And I think looking at a lot of our clientele either don't have the means or the ability to navigate that system. It's very complicated. Just take insurance.
Yeah.
I can barely, come on. And so to me, this is a comprehensive and loving approach to meeting more than one need because we can, right? And saying there are already people doing very important niche services, providing important niche services, but chances are one of our clients walks through the door because she's facing an unattended pregnancy, she's got other needs.
Yeah.
And imagine being handed an iPad and no judgment, nothing. You just click boxes like, I don't have secure housing. My immigration status is not secure. Like there could be so many things, and this place just wants to show up and help me.
Yeah.
All I have to do is be here. Like I'm excited and hopeful, but I'm also not in the day-to-day weeds of building demo and all the things Talitha has been in.
No, I mean, it even for anybody, listening with like organizational leadership experience, like this, one of the reasons this excites me the most is, I mean, we talked for years at Claris, we talk constantly here at Cornerstone about the temptation of mission drift, right? And because when you are helping people in need, you don't just see the need you're addressing, you see all the other needs. And the temptation is, as an organization, to try to do everything. But if you're doing everything, you end up not doing anything well, right? Yeah. And so instead of expanding organizationally to do things that you're not actually uniquely suited to do, to simply create an umbrella and even a very physical space where people can do the things they're good at, the things they are uniquely good at, the things that they have years, decades, even generations of experience navigating and working, to create in that sense, a platform where you can all focus on what you do well together is just, it's inspired. It's so exciting to me. So exciting.
There's something too that I love about Claris is recognizing that there are different people for whom, not everyone is going to provide be able to receive the same kind of care from different people as you are. That was unclear. Yeah. But what I mean is there are different people who should be helping that person than maybe you in that situation, right? And it goes back to what you were saying, Talitha, about, and what I was trying to get to with the lack of clarity, is that deep mistrust many people have in the medical system, rightly earned, right? Because there has been so much heartache and so much trauma that has affected people. And the fact that we can come with different kinds of people, with different perspectives and experience, backgrounds, and generations of, that wealth of knowledge. Like, I'm so hopeful because that's saying, yes, we have a target client. We always talk about our bullseye, like woman and family, that person who's facing an unattended pregnancy decision, and how we're coming beside her before, during, and after that. She doesn't always look like me. Right? She doesn't always look like you. She is going to be one of the many, 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 many diverse people in our city. And I want to be able to meet her where she's at. Yeah. And that means we need a deep bench. And that goes beyond even our own walls. Yeah.
Love that. Okay. So we also love and are super passionate. I mean, this is super exciting. This is super exciting for South LA. This is super exciting for Inglewood. We're also deeply passionate about the work Claris is doing here in West LA and the medical clinic just down the street, the resource center here on our campus. What does this mean for Claris in West LA? Are you moving? What's going on?
No, actually, that was a very conscious decision that this is not. We will move our Linwood clinic into the new campus, but we won't leave the West Side, and for a lot of reasons. I mean, one, our West Side clinic is busy, and the parenting support center here is very busy. Yeah. And we would never want to lose that or leave that. We have deep roots here. And I think the city's big. I would love to add a couple more in parts of the city, not subtract. And I think, being able to get somewhere is important. And I think, getting to Inglewood is not always easy for
sure. For somebody from West LA.
Yeah. So no, we're not going anywhere.
Awesome. Well, that's super exciting. We love, super excited about what's going on there, and also love the work that the Lord's doing through it here in West LA and here on our campus. I mean, I genuinely just consider it such a privilege to get to partner in the ways that we do, and seeing the day in and day out busyness of the parenting resource center here. I mean, it's such a blessing for this part of our city in particular. So, okay, how can we, with all this going on, and in the midst of the this new development and the demo going on with the building and the plans for it, how can we be praying, and how can we as a church continue to support the work of Claris into this next phase?
Yeah, I think we can both answer from different perspectives.
Sure,
I think, it's really sweet thinking back. It was, you're coming to us and saying, hey, I have this idea. We just got this campus, and maybe Claris could, occupy some space. And I'm like, here we are. And it has been the sweetest partnership for so many reasons. And one, I love that everyone who visits here gets to see the church in a very positive light. Like, here is a church that is helping. And everything, you guys can't even imagine all the stuff that goes up and down the stairs here, and how many times somebody from the church will be like, can I help you? Can I help you carry that stroller up the, the stairs, or can I? So, but I think, practically speaking, we always have, volunteer opportunities. I think one, the program I mentioned, the Every Mother's Advocate, EMA, we're always looking for people to mentor. We're looking for, and that is very much moms, but we also are mentoring a lot of men. And I'm thinking of one guy right now that we're helping out with reunifying with his son, and how there are so many people involved in this from Claris, but he spoke at our gala, and some men went up to him after the gala and gave him their cell phones, and they've been met. And when tragedy hit his life a few weeks later, he was able to reach out to men who were Claris supporters, who just said, hey, I'll be there for you. And now they're mentoring him. And so just sort of the ripple effect of that, I think, is incredible. So volunteering, spreading the word, I would say it's really helpful for us, people that follow us on social media and share some of the posts that then other people know. If you know anybody that ever needs help, or if you run into somebody, you can always send them to us. Or if you don't know whether it's something Claris does or not, just call us, and we'll either connect you to someone else in the city, or we'll help. And then, if there's something that you've heard today that you're really passionate about, it is going to take an army and a lot of miracles to build this campus. And I'm, so thankful that we, especially everything that's happened in our city recently, that we do serve a God who specializes in restoring and in, I think of just obviously all of us, I think, are thinking of the scripture of just he takes these ashes and creates something beautiful. And I'm like in the middle of the rubble of this building, and then the fires in this city, like God's doing some really new things, and it often comes from a lot of pain and brokenness. And that is a story that Claris is so familiar with, as we've watched people for decades who it seems hopeless, and then God turns it into the most beautiful thing. And I think it's the most, I am so privileged, because sometimes I'm in the delivery rooms and I'm, seeing these miracles happen in front of my eyes. And just such an opportunity. So if it's something you want to be involved in, whether it's, giving money, getting involved, spreading the word, we need it all. And,
awesome.
I would ask for just prayer for our direction as we move forward, and that not just for the big picture things, but for there's a million tiny decisions that have to be made every day. And just that God would be directing those and giving us a ton of wisdom. I think we are very eager for wisdom. And then I'm also would appreciate prayer for us as I think the approach and the focus for the board in this season is ensuring the health of the organization as we ramp up our growth, because we're about to, Lord willing, experience exponential growth as we move into this campus phase and not increase our services, but hopefully increase our bandwidth to provide those services. And so it feels a little bit like a put your own oxygen mask on before you can help others. But Talitha's both the pilot and the person who needs oxygen sometimes. And so that's really what we're trying to do is as the board and the leadership, we're trying to help Talitha care for herself and her people. Talitha's taking a sabbatical this summer.
All right. Now we're talking.
First time in 24 years.
Now we're talking.
So just like
Jackie, you did something I couldn't do. That's great.
Isn't that amazing? It wasn't
Miracles.
4 years later. I was literally in Genesis this morning meditating on rest and on God's design, that the work wasn't done until he rested and enjoyed it. Enjoyed the work that he'd done. So I'm just praising him right now that Talitha's going to get that 7th day in these years to hopefully rest well, and that we can send her to do that well. So prayer for that, and that we don't let the ship sink while she's gone.
No, that's so beautiful. And I love, I think for anybody who's been a part of Cornerstone for any amount of time, you probably catch that as a part of our heart, that
we love a sabbatical.
We do, because the path to growth and multiplication springs from genuine health, right? From the health of an organization, from spiritual health, from our own, and so that those two things go hand in hand. And I think sometimes in the most exciting moments is when we can be tempted to lay it to the side, but it's in the most exciting moments that we need it the most. And so that the coupling of that doesn't sound like an accident to me. That's really beautiful and something that we can all be praying for the organization, both for a time of a season of expansion and multiplication, and a season of continued and deepening health for the entire organization. So, thank you so much for the time. Thank you so much thank you for everything you both do, and for the incredible partnership. We love Claris so much, and it's such a privilege to get to be a part of it with you.
Thank you.
I'm happy to be here.
And thank you all for listening. We love you, and we'll see you on Sunday.